Equine influenza, often called equine flu, is a highly contagious viral respiratory disease caused by an influenza A virus, subtype H3N8. It's endemic in the UK, which means it's always around, and we see outbreaks every single year. The virus loves the ciliated cells lining the upper airway, and once it infects them, those tiny hair-like structures stop working. Owners see coughing, students see mucociliary clearance failure. Equine flu spreads through airborne droplets from coughing, and yes, they can travel surprisingly far in the wind. Through direct contact, nose to nose is basically a viral handshake. Through shared equipment, buckets, hay nets, tack, grooming kits. Through transport, trailers are basically viral Ubers. And the incubation period is roughly 1 to 5 days. This means that the horse can spread the virus for up to a week before we start seeing clinical signs. Here's what owners actually see. A fever of over 38.5 degrees, frequent harsh dry coughing, clear nasal discharge that may turn yellow or green, lethargy, that I don't feel like being a horse today kind of look, loss of appetite, and swollen lymph nodes, especially under the jaw. For students, remember that the cough comes from irritation of the airways and loss of ciliary function. It's not from lower airway disease, unless complications have developed. The gold standard diagnostic is a nasopharyngeal swab for qPCR. This detects viral genetic material, and it's most accurate in the first 48 to 72 hours, when viral shedding is highest. We can also run paired blood samples, one when the horse is sick and one a few weeks later. With this, we're looking for rising antibody levels. There's no antiviral treatment for equine flu. Management is all about supportive care and protecting the airways so they get a chance to heal. Strict rest. The classic rule is 1 week of box rest for 1 day of fever. NSAIDs to reduce fever and discomfort, which will be prescribed by your vet. A low dust environment such as soaked hay and good ventilation. You want to keep them hydrated, a plentiful supply of fresh water, and palatable forage. And we're going to monitor the temperature daily. And please don't rush them back into work too soon. Turning too early risks relapse, pneumonia, and even myocarditis. The single best defence is vaccination. These are at least annual, but competition horses require them more frequently. Vaccinated horses may still get the disease, but they shed less, recover faster, and show fewer clinical signs of the disease. And of course, they're far less likely to spark an outbreak. And don't forget biosecurity. Isolate new arrivals. Don't share equipment. Disinfect transport. Change clothing between yards. And keep sick horses at least 100 metres away from others. Be sure to call your vet if your horse has a temperature above 38.5 degrees C, if it has a harsh or persistent cough, nasal discharge, lethargy or poor performance, or if any horse on a shared yard starts coughing, treat it like an outbreak until proven otherwise. Equine influenza spreads fast, but with good vaccination, good hygiene, and early recognition, you can stop it dead in its tracks. Share this with your yard so that one coughing horse doesn't become 20.